Can drugs really induce or help bladder urinary retention? Have you ever wondered if medications can really affect your ability to urinate? The answer is yes, certain drugs can indeed induce bladder urinary retention. This condition refers to the inability to empty the bladder completely or at all. Urinary retention can be acute, which happens suddenly and severely, or chronic, which develops gradually and persists over time. Drug-induced urinary retention occurs because many medications interfere with the complex neural and muscular mechanisms that control bladder emptying. Some drugs known to cause urinary retention include those with anticholinergic properties. These can be found in certain antipsychotics, antidepressants, and respiratory agents. Opioids are another class of drugs that can lead to this issue, as they act on specific receptors in the body and can cause urinary retention in up to 25% of postoperative patients. Other medications that may contribute to urinary retention include alpha-adrenoreceptor agonists, benzodiazepines, non-steroidal anti-inflammatory drugs, calcium channel blockers, and detrusor muscle relaxants. These medications can impair the bladder muscle's ability to contract or increase the tone of the urethral sphincter, making it difficult to urinate. For instance, selective serotonin reuptake inhibitors, like fluoxetine, have been reported to cause urinary retention. This may happen because they can increase the activity of the external urethral sphincter or reduce bladder contractions. Interestingly, non-steroidal anti-inflammatory drugs have been associated with an increased risk of acute urinary retention, especially in men who have conditions like benign prostatic hyperplasia or prostate cancer. Elderly patients are particularly vulnerable due to the presence of other health issues and the use of multiple medications. If someone experiences drug-induced urinary retention, management typically involves catheterization to relieving bladder distension. It may also require discontinuing or reducing the dose of the medication causing the problem. Preventive strategies, especially around surgeries, include careful selection and combination of analgesics to minimize the risk of urinary retention. On the flip side, some medications are used to help with urinary retention. For example, alpha-1 adrenergic antagonists, also known as alpha blockers, are prescribed to relax the bladder neck and prostate smooth muscle in men with benign prostatic hyperplasia. This helps reduce outlet resistance and improve urine flow. However, these drugs do not induce retention. Rather, they are used to counteract obstructive causes of retention. Understanding drug-induced urinary retention is crucial for maintaining bladder health. This is especially important for individuals with bladder cancer, who may be on multiple medications that increase the risk of retention. Complications from urinary retention can include bladder overdistension, infections, and impaired bladder function, all of which could affect cancer diagnosis or treatment outcomes. In summary, many drugs can cause urinary retention as an adverse effect by disrupting normal bladder emptying mechanisms. Conversely, certain medications are used to alleviate urinary retention caused by obstruction. Being aware of these effects is essential for proper management and maintaining bladder health. Always consult healthcare professionals for personalized advice and treatment options.